I'm a second-year medical student who grew up in Cincinnati, attended the University of Oklahoma, and then went abroad for my graduate studies. I lived in London for a number of years, where I studied neuroscience and worked as a nurse's assistant in a publicly funded NHS hospital. Moving from the privatized US healthcare I had known to the publicized European model, I was able to see that my upbringing had blinded me to some of the faults in our deeply broken insurance system. I learned that a better way was possible, and that public health care is not an impractical fantasy, but rather a lived reality for nearly 70% of the first world population. As I have begun my medical training, I've come to believe that Medicare-for-All is not only a feasible political possibility, it is an urgent moral necessity. As some of you know from firsthand experience, it's a shamefully common occurrence for Americans to be forced into making horrifying decisions between death and bankruptcy. And one story that stayed with me is that of a mother learning that her infant daughter had a terminal autoimmune disorder and would not live to see her first birthday without treatment. Unfortunately, the treatment that she needed cost more than $11,000 per month with her mother's insurance. This was obviously incredibly devastating news, but to me, even more heartbreaking was her mother's reaction. Not to ask how she could possibly afford the treatment, but to begin trying to calculate, based on her savings, how many months she could afford to keep her daughter alive. This is not conscionable. This child did nothing wrong. No amount of healthy lifestyle choices, hard work, or personal responsibility could have prevented her illness. I'm not as well-versed on the politics and the economic nuances of Medicare as some of my colleagues are, but to me this is an ethical issue. No one deserves to die because they can't afford medical treatment. Illness is not a punishment for bad choices or a failure to plan. And health is not a reward that you earn through gainful employment. It's a basic human right. And our country's decentralized healthcare system has resulted in crippling debt, unnecessary suffering, and preventable death. I understand that many have concerns regarding the financial and practical aspects of such a change. However, I would argue, like my colleagues, that the role of a government should be at times to assume the burden of policies which exist to serve the public good rather than to generate profit. For example, we're willing to federally provide for public school costs for children because we believe collectively that it's more important to live in a country where children have access to education rather than a country where schools are sufficiently profitable to their investors. In the same way, I support Medicare for All because I believe that it's more important to live in a country where people do not have to die of preventable disease just because they're poor or unemployed or exceptionally unlucky, rather than a country where hospitals are sufficiently profitable to their investors. We, as future physicians, have a responsibility to help our patients, and with financial considerations limiting what we can do for them, our hands are always halfway tied, which is an invisible binding that many Americans don't even notice because they've never known anything different. They were born into this. I empathize deeply with the questions and fears that many in this room have in contemplating such a radical shift in policy. However, I hope my testimony has encouraged you to consider that our personal politics cannot supersede our moral convictions. Thank you very much for your time.